am Dr. Stickney, and welcome to Ask the Vet Live with Spay Neuter Network. It is good to have all of you join us today. I am going to answer any questions that you send in here over the next 30 minutes. I also have several that were emailed to me before we started today. So we'll address any questions that you may have about things. We will also talk about events that are going on with Spay Neuter Network and things that are happening that may be relative to your pets. And let's go ahead and start doing that. The first thing that I would like to say is that April is Volunteer Appreciation Month. And I want to give a big heartfelt thank you to all of our volunteers that help us here at Spay Neuter Network. Your contributions really help make what we do possible and allow us to best care for pets and the people that bring them to us. We have a couple of volunteers that are regulars here at our San Antonio location, and they are such an amazing help. And they've been with us for a long time. They know all of the things that need to get done, and they get them done efficiently and do them well. So I just want to, and I know that goes for the volunteers at all of our other Spay Neuter Network locations. So let me just say thank you from all of us at Spay Neuter Network for your help. The other thing that I want to mention is that April is Heartworm Awareness Month. And this is a very timely topic because I did get a lot of questions in about heartworm disease and questions related to their pets with heartworms. So I thought I might start with just talking about what heartworm disease is and why it's important to use heartworm preventative. Heartworm testing and heartworm preventative are two of the things that we do a lot of here at Spay Neuter Network. Everybody in the state of Texas, and really everybody that can see this and hear this, should have your pets on monthly heartworm prevention. There is also an injection that lasts for longer than that, but you want to have them on year-round heartworm prevention. So the heartworms are spread by mosquitoes. So let's talk about the life cycle of the heartworms and how that works. So dogs are the natural host for the heartworm, and heartworms are parasites. They look kind of like spaghetti. They can grow up to a foot long, and hundreds of them can be in some infected dogs' hearts. They live in the heart chambers and primarily in the what is called the main pulmonary artery of your heart, and that is the blood vessel that goes from your heart to your lungs, so that blood can pick up oxygen and go to the rest of your body. So your heart is one of the muscles in your body that never gets a break, right? I can stand at work all day and then I can sit down and give my leg muscles a break. Our hearts never stop. It's a bad day when they do. So they're always going, whether we are awake, whether we are asleep. So it's important that our hearts are healthy, and it's important that they be able to pump blood through our body without anything getting in the way. And that is what happens with heartworms, is that they are physically blocking the ability of the blood to move from the heart into our lungs. Therefore, the heart has to work harder and becomes more stressed, and then a process of inflammation occurs that then makes everything a little smaller and not work as well, and it's just a vicious cycle. So heartworms are in dogs. You can also have them in cats and in ferrets and a few other species, but dogs are the primary hosts. The heartworms in the dogs, in the dogs, we'll have males and we will have female heartworms, and the females will lay eggs, and those eggs hatch into what are called microfilaria, which are baby heartworms. And these are microscopic. They're very, very small. You can't see them with your naked eye, but you can have up to 60,000 of them in 1 milliliter of blood. So an infected dog can have a lot of baby heartworms circulating in its blood. Now, along comes a mosquito, and it bites the dog. And when it drinks the dog's blood, it sucks up all of those microfilaria as well, all of the baby heartworms as well. The baby heartworms grow a little bit inside the mosquito, and then the mosquito goes over to another dog. And when the mosquito lands on the dog, it spits a little bit, puts a little saliva on the dog, and that saliva is there as an anticoagulant so that when they bite the dog, the blood doesn't clot and they just suck it right up out of the dog. But that's mosquito spit, that mosquito saliva now contains all of those baby heartworms. When the mosquito's uh, nose goes into the skin, it makes a little hole, and that saliva goes into the hole, and now all of those baby heartworms go into your dog. And over the course of the next 6 months, those baby heartworms migrate through your dog to the heart and become adult heartworms. So, that is the life cycle of a heartworm in a nutshell. Now, that is where monthly prevention comes into play because every month the heartworm preventatives that we give are killing all of the baby heartworms that are in your dog already trying to make their way to your dog's heart. So it kills all of them, then, but it doesn't have any sort of a residual effect. It works on that day. So now, if your pet gets bitten by a mosquito the very next day, the heartworm prevention is not there anymore. The preventative isn't doing anything to kill any of the baby mosquito, any of the baby heartworms, the microfilaria. So that's why we have to give another dose in a month so that we are able to kill the next round of baby heartworms before they can get to the heart and turn into heartworms. So it's a monthly cycle of killing the baby heartworms so that they don't grow into adult heartworms. That is how heartworm preventatives work, and it is important to have your dog tested for heartworm disease before you start a preventative because those heartworms because we if we have heartworms already present, we need to address those and kill them, and the heartworm preventative will not do that. And there is also a risk if your dog has a lot of baby heartworms circulating in its blood that the heartworm preventative can cause those to rapidly die and cause a severe allergic response in your dog. So we want to test our dogs every 12 months, and we want to have them on 12 months of heartworm preventative, regardless of the time of year, regardless of whether it's cold or not. My dogs are on monthly heartworm preventative. Yesterday, there was a mosquito in our house, and we killed it, and it already had blood in it. It hadn't bitten anyone in the house, so that means that it bit one of the dogs. So that is already happening, and that is the reason why we give heartworm prevention, because you never know when that mosquito is going to land, but it will, and your dogs will have those baby heartworms injected into them. So you want to have them on monthly preventative all the time. So with that, let's take a look at some questions that have come in while we wait for some others to pop up live. So we will, since we were just talking about heartworms, let's start with some of the heartworm questions that I have received. So, all right, Jocelyn writes in to say, hello, I took my chocolate lab for a checkup in July of 2025 where she tested positive for heartworms. She was put on a medication, Pyrantel and doxycycline, and she's on TriHeart. When can she get retested to see if she still has heartworms? Okay, so let's talk a little bit about treatment. Because what it sounds like is going on with your dog, Jocelyn, is that your veterinarian is utilizing what is called the slow kill method. So there are two ways that you can treat heartworms. The way that is recommended is the fast kill method, and then another way that can be used that some veterinarians will utilize is the slow kill method. The fast kill method involves about 3 months of very strict exercise restriction, during which time some medications are given that will make the heartworms weaker and more susceptible to 3 injections of anti-heartworm medicine that will kill the adult heartworms. The advantage to the fast kill method is that those heartworms die right away. With the slow kill method, what you are doing is preventing any new infections of heartworms and waiting for the low levels of heartworm preventative to slowly kill the heartworms. And those adult heartworms can, with the slow kill method, live for 2 to 3 years, during which time they are still growing and still causing damage and swelling to the heart and the surrounding blood vessels. So, if you are able to, you always want to choose the fast kill method, and that's something that you want to talk with your veterinarian about and make sure that your dog is in good shape to handle that. So, with your particular dog, I would test your dog in 12 months and see if you're still positive or if your dog now tests negative. And if it tests negative, fantastic, stay on monthly heartworm prevention. But I will bet that your dog will still test positive. And you will want to consider talking with your veterinarian about the fast kill method and getting those worms dead before they cause any more damage or issues in your dog. Okay, let's see here. Okay, Jacob writes in and says, my dog recently tested positive for heartworms, and we are waiting to find out if it's a low or high worm burden. My vet recommended the slow kill method and said my dog can continue normal activity, but most information I'm seeing online recommends the fast kill injections with strict exercise restriction. I'm confused about the different recommendations and worried about making the wrong decision for my dog. What treatment approach is generally recommended, and should exercise be restricted during treatment? So, again, Jacob, great question. And I'm going to give a very similar answer that the fast kill method is the recommended way for treating heartworms. And the reason is that the longer the heartworms are there, the more permanent damage they cause to your dog's heart and lungs. So, the advice that I would give you would be to ask about doing the fast kill method and doing that if you're able to. Um, the You do have to do strict exercise restriction during that time, and that's because the heartworms are rapidly dying. And if the dog is very active, those little pieces of heartworm can cause severe lung issues and breathing problems with their dogs. So they have to be very strictly confined, but once the treatment is over, they can go back to their normal activity. And we have some really good sedatives that will help your dog to stay relaxed and quiet while it is confined during that time. So, talk to your veterinarian about the fast kill method and things that you can do to keep your dog quiet during its time of exercise restriction, and get that nipped in the butt. Okay, James writes in and asks, I've heard heartworms are transmitted by mosquitoes, but how exactly do pets get infected? Can indoor pets still get heartworms even if they aren't around other animals? And I think I'll answer the second part of that question first, is that mosquitoes come into our house this time of year all the time. They are waiting by the front door because they can tell that air is cooler in there, and they fly on in and you never see them. And the next thing you know, you're sitting watching TV and you start itching because a mosquito just bit you. So, yes, mosquitoes can get in and they can bite our dogs and they can bite our cats. So, like I said before, the mosquitoes spread the disease because they have bitten an infected dog and have drank a lot of the baby heartworms, the microfilaria, when they took that blood meal. Then they fly over to the next pet, whether it's a dog or a cat. They release saliva on the skin, and then when they stab their needle nose into the pet to start drinking blood, that saliva goes in through the little stab, and now we've got thousands of baby heartworms under the skin ready to travel to the animal's heart. So that is how that happens. And I should stress here that cats are susceptible to heartworms just like dogs are. But testing a cat is more challenging than testing for a dog because cats usually only have 1 or 3 worms that actually survive to get into the heart. because cats are not the normal host species. They're not the preferred species for heartworms to live in. But cats are very good at swelling and inflammation. So those couple of worms can create a lot of damage to their heart and to their lungs. So the recommendation is that cats always be on heartworm prevention no matter what, because they can get it just as likely as dogs can. Excellent questions and an excellent topic. Before we move on from heartworms, I will just say once again, come to Spay Neuter Network or your veterinarian, get your dog tested, make sure you're on heartworm prevention. Okay, let's see some other questions that we have. Spencer writes in to say that my cat is a former trap neuter release cat and still very shy. He's been with me about 3 months and has only been to the vet for his neuter and vaccines. This morning I found a worm and some vomit from a hairball. Can worms be treated with over-the-counter dewormers at home, or should I take him to the vet? I want to avoid stressing him if possible, since he's just starting to get comfortable. Spencer, I totally hear what you're saying. You know, this cat is he's in a whole new kind of environment now. He's learning to trust you and to get used to the way things are in his life of comfort compared to the life he used to have. And you know, we don't want him to think anything stressful is going to happen right now while he's getting acclimated. So, yes, you can use over-the-counter dewormers. The issues with those are, number one, we don't know exactly what parasite we're treating. There's lots of different worms, and different medications will affect different ones. Secondly, oftentimes the concentration of the drug in those over-the-counter medications is not as strong as what you would get here from your veterinarian. So, an option that you have, though, to not stress your cat is to take the worm or a fresh fecal sample from your cat to the veterinarian. They know who you are. You have an established client-patient relationship. They can run that fecal, see exactly what the parasites are, and give you the appropriate dewormer for you to give at home. And that way, your new cat doesn't have to make another stressful trip to the vet. That is a great question. Okay. Jessica writes in to say that she is thinking about taking in an unvaccinated puppy that appears sick from someone who can't afford care. I understand the puppy may have serious health issues, but my main concern is whether it could make my 8-year-old fully vaccinated dog sick. My dog is vaccinated, but does have some health issues like allergies and arthritis. Don't we all? So that is a great question. And I think that your vaccinated dog is very, very unlikely to get any kind of an infectious disease from the puppy. But I would be concerned about the puppy getting something from your fully vaccinated dog. Yes, your dog is vaccinated from all these different bacteria and viruses, but your dog is still exposed to them whenever they go outside or do whatever they do, and they can bring those inside to your house. It doesn't bother your vaccinated dog because they're protected. But this little puppy is not. And if he's around that dog and gets, and if your dog was wandering around and got some parvovirus on it and now tracks that into the house, all of a sudden the puppy is exposed to parvovirus and doesn't have any sort of immunity to it. So I would keep them separated until your puppy is fully vaccinated. Then I would allow the two to get together and start to be buddies. But right now, I would keep the unvaccinated dog away from the vaccinated dog, mainly to protect the puppy. Okay. Heather writes in to say, I care for about 9 stray cats in my yard, and one recently tested positive for FELV. FELV is feline leukemia virus. The cats often eat from the same plates and stay close together. Separating her isn't possible because I don't have the space and I also have indoor cats. If I vaccinate the other cats now, will the FELV vaccine still help protect them even though they've already been living together? The answer is yes. So, feline leukemia virus is spread from cats having close contact. A lot of it has to do with the cat's saliva. So if the cats are grooming each other, that is a major mode of transmission. It can also be spread from sharing water bowls and food bowls, but that close, lovey-dovey cat contact is how that virus is typically spread. So we know the one cat is positive. Doesn't make any difference if he gets vaccinated or not. Vaccinating him is not going to help. Vaccinating that cat's not going to do anything to help him. But we would want to know if the other cats are already feline leukemia virus positive or negative. And if they are negative, we should vaccinate them. And that vaccine will provide protection for those cats. No vaccine is 100%. So, it is possible for a vaccinated cat to be exposed to enough viral particles that it does get infected. But I'm going to take the best odds I can, and those are going to be to get vaccinated to prevent that. So I would recommend having your other cats tested, and if they are negative, getting them vaccinated. Great question. Okay, Eddie writes in to say, I applied Brevecto to my cat on January 8th after fleas were found at a vet visit. The fleas seemed to decrease at first, but now when I brush him, I'm finding several fleas and a lot of flea dirt again. Would switching to Revolution Plus be a better option? And is it safe to start it now after previously using Brevecto? Is there anything else I should be doing to help control the fleas? Eddie, this is a great question. And if you are anywhere in Texas and lots of other states, but here in Texas, fleas are a never-ending problem. Great job having your cat on flea prevention. Every pet should have monthly or every 3-month flea prevention in the case of Brevecto. So you're doing a great job. Now, if we gave the Brevecto on January 8th, so we went February 8th, March 8th, April 8th, that is 3 months, and Brevecto is labeled to prevent those fleas for 3 months. So we are reaching the end. We have reached the end of that dose of Brevecto having its strongest efficacy. So it is time to redose that. Or if you wanted to start with Revolution Plus, you could do that. That is those drugs work by different mechanisms. That's not going to cause a problem at all. Both of them are excellent products. I have used both of them at various points in the past. So if you are seeing fleas coming back onto your cat, even with treatment here, as it's starting to kind of wind down, what that tells us is that you have a lot of fleas in your environment and that the cat is being exposed to new fleas that are hatching from their eggs and that they are laying eggs and creating a whole new batch of fleas. So a couple of things that you can do. One of the most effective things to help reduce a flea burden, in addition to having all of your pets on flea prevention, and that's key, because if they're not all on flea prevention, the fleas are going to go to the ones that they can survive on. So, and you haven't really solved the problem. So you want all of your pets in the house to be on flea prevention. The other thing that makes a tremendous difference is doing things like regularly washing the dog's or the cat's bed wherever it likes to sleep or play, if it has a special little spot, and vacuuming regularly, because that vacuuming is going to suck up all of the little flea eggs that are in the environment, and then you dump the vacuum in the trash, take out the vacuum bag, however your vacuum works, and you get all of those eggs out of your environment. It's important to move your furniture around because those fleas will like to go into the cooler, darker places to lay their eggs. So that's where there'll be a lot of them. So you want to vacuum your house really well, get those as many of those eggs out of your environment as possible, and then make sure to continue your flea prevention. You're doing a great job. You've just got a lot of fleas that we have to get under control. Here is a question that just came in that says, is 2.5 to almost 3 years old too dangerous or bad to spay my golden retriever? She was my, let's see here. Okay, she was my daughter's dog. I have inherited. Congratulations. I know how that goes. I need to get caught up on her vaccinations. Let's see. I need to get caught up on her vaccines and get her spayed. Same dog, both my golden and my granddaughter's Chorky are both licking and digging at their rear ends. What am I looking for? What am I looking for them? Is it itchy allergies, bugs, worms, glands, etc.? Thank you. Okay, so a couple of questions in there. The first question, the easiest answer is that no, 2.5 to 3 years old is not dangerous or too old for your dog to be spayed. Dogs are seniors at 7. So, we're in the prime of life right now. So there will not be any issue with that, assuming, your dog is otherwise healthy. And I think that it is. There is no increased risk from having them spayed or neutered. And it's going to then keep you from having to deal with heat cycles, dealing with roaming behavior, dealing with other dogs trying to get into your yard and breed your dog. And now you've got surprise puppies, and that's not a surprise everybody wants. So yes, go ahead and get it done. And I see that you are on that already, and that is fantastic, Carolyn. Now, your second part of your question is, we've got dogs in the house that are licking and digging at their rear ends. What am I looking for? Is it itchy allergies, bugs, worms? Okay. So, great question. Several possibilities. The first thing that I always do before I get excited about anything else is making sure that they are on some kind of a monthly flea prevention. Fleas are itchy and they are everywhere. And, you can say, people will say, I don't have fleas in my house. I don't have fleas in my yard, but you know who does? Your next door neighbor. And the fleas don't care about the fence. So they're just going to hop right over. So they need to be on some kind of monthly flea prevention. Flea allergies are very common in dogs, and they are primarily itchy right around their rear ends. So that would be step one. Get them on some kind of flea prevention if they are not already. So if they are, then the next thing to think about was, do they have some kind of GI parasites, worms that are causing some sort of irritation? Do they need to be dewormed? The other thing to think about is that they could have seasonal or environmental allergies, like so many of us do. And golden retrievers are one of the poster child dogs for environmental allergies. So that and Yorkies are up there as well, but especially golden retrievers, and that can make them extremely itchy. They will especially like to scratch at their ears and lick at their paws. So that's a possibility as well. I see here you have commented that you don't see anything. You vacuum daily and bathe them. Flea collars, need to get them on prevention. Yes, flea collars are nice, but they are not nearly as effective as one of the monthly flea preventions we can get for you. So definitely let's get some of that when you bring them in, and let's start there and see if that doesn't give us some relief. That is a great question, and that is a very common issue that we are going to see here now that it's starting to warm up. Is we're going to see that with the warm weather, we've got the fleas and we've got the allergies, and golden retrievers can be really challenging with those. So step one, a good flea control program, good topical or oral flea prevention. Let's see. Here's another question that comes in that says, how much should a German Shepherd weigh at 11 months? A female that is extremely active. Well, that is kind of a hard question to answer, because they're all a little bit different in size. They all have different genetics. German Shepherds they tend to be a very lean looking breed of dog. So they can look really skinny, but they're actually really in great shape. And the last thing we want to do is to have our golden retriever I keep saying golden retriever because I was just talking about them. The last thing we want to have is our German Shepherd getting too heavy, putting on too much weight, because that is bad for their joints, and German Shepherds are notorious for developing hip problems. So we want them to be at a nice body weight, a nice lean body weight. So the things that I will do is to check if I'm where I need to be with my pet is that I will look down, I'll look kind of stand over them and look down on them, and they should sort of look like an oblong hourglass. So I should see their ribs, and then they should have a little tuck at their waist, and then it should flare back out at their hips. If I look down on them and I see two straight lines, then they're too heavy. The other thing that I want to be able to do is when I pet their side, I want to be able to feel their ribs easily, but not be able to see them. I shouldn't have to press through an inch of fat to feel their ribs. So those are the big things that we are looking for. I would say that if your dog is active and you are feeding a large breed puppy food or a large breed adult food at this time, you are probably in good shape. If you are concerned, though, you do want to go and see your veterinarian, make sure we don't have GI parasites being an issue for that dog and any kind of weight issues or anything else. That is a great question. So let's see. And then a follow up for, okay, I can see my pup's ribs a little. Okay. So, and that may be normal for your 11-year-old German Shepherd because they're going to fill out a little bit. So what I would say is that take a look at what you're feeding them, and there will be some kind of feeding recommendation on that bag, and it's going to say, you know, for dogs in this weight, feed this much, or for growing dogs, feed this much. And what you want to do is pick the low end of that food of that range of how much to feed them. Start there and then see how they are doing. And if they are, you know, acting like they're starving, most dogs do anyway, but then feed them a little bit more and kind of see if you see a change over a month or so, one way or the other. And then let's see. Carolyn asks, "Is there a preferred brand?" You know, at Spay Neuter Network, we have Brevecto for cats, and we have the Celerid, which is the generic of Revolution. Those are both great things that we have that we can get for you when you come see us. Thank you all for joining me today on Ask the Vet Live. We have a few other questions I was not able to get to today, so we will roll those over to next time. In the meantime, everybody have a fantastic April. Good to see y'all. Get on Heartworm Preventative. Bye-bye.